Salandra Rise evaluation project is a partnership between VicHealth now and RMIT and a range of other organisations. What we went through in the initial stages was to create an evaluation, a concept, so to try to understand how can you evaluate health and wellbeing in a community master plan process. We went through a competitive public process, and RMIT as a leader in planning and the development of communities won the opportunity to drive the evaluation of that project.
Salandra Rise is a demonstration project being built in the city of Casey, and it's a demonstration project because there's a number of unique partners involved, and the idea behind Salandra Rise is to trial a whole lot of best practice planning principles for health and wellbeing to see if the health and wellbeing of residents can actually be improved through design.
We're very much a customer-led business, and understanding our customers from an insight perspective will help our business better tailor our product options to our markets. So we saw the Salandra Rise demonstration project as being a great opportunity to more intimately understand our customers, what they demand from a community, and I guess as a developer, have an ability to better provide product that suits their needs.
The project itself, the evaluation is still underway. It's a 5-year research practice fellowship that VicHealth have supported through a partnership with RMIT. What Cecily is able to do in her work is quite unique in that she is developing relationships and evaluating the community connections that people have before they move into Salandra Rise, as well as what they develop when they're there. So we're finding what's important to people in the development of a community. So it's putting people at the centre of community planning, and what we're finding is that access to open space, to parks, to opportunities to connect with other people through community houses and neighbourhood centres, and essentially opportunities to improve connections, physical activity, healthy eating, and opportunities to meet and gain social connections with others are the most important things to people in community planning.
To have everything so close by and such an abundance of things that are available to families and children is really helpful to us as parents, because you're always searching for new activities and new things for children to go to, or even shopping centres they have fun in. So to have those things so accessible to us where we live is great. It's just a really great place to live.
Yeah, probably the commercial benefits of undertaking an innovative approach to residential community development. A very responsive, education-based approach to understanding customer insight and then responding with appropriate localised employment initiatives, diverse product options, and then also health and wellbeing initiatives is very much a point of difference for Salandra Rise in market. Our competitors don't offer what we offer at Salandra Rise, and we see that as a commercial advantage, and has certainly held our project and this community in good stead.
I think the research will help understand what sorts of planning and design can really make a difference to people's health and wellbeing in terms of an everyday life sense. So having places they can walk to, making workplaces and homes closer together, and that sort of thing will hopefully mean that these principles that are being tested at Salandra Rise can be used to design and plan and deliver future communities.
The research methodology that has been evolved as far as the longitudinal study is concerned is something that could be applied more broadly to other developments, and not necessarily within a greenfields environment, certainly within an inner city environment or whatever the case may be, that these types of learnings could be evolved and applied to a local context.
So the work that RMIT are doing in this project is essentially central to it. So VicHealth's role is to fund the evaluation. Without the work of RMIT, we wouldn't have that evidence base that will take us and all of the organisations, including state government and growth area authorities and developers, into a position where they now have evidence to ensure that the next community is as healthy as the one before, and that's the basis of that is the work that RMIT are doing.